Okay. Oh, none of you. Welcome. I know you we mute you, so I cannot hear you. But welcome, and to our. Got it. Hold on. Okay. I have Anne. Yeah, I can see Anne. So everybody, and today is my pleasure have all of you, and also our instructor is Margie. And Margie, wow, she has a full title here. Let me name it that you know who she is. She has been with SESHA for the past 20 years. She knew almost every product. I always discuss with her. So by all means, if you have some question regarding how to use it, how to do it step by step, Margie will be a good person to go. So, and Margie is, of course, she's an esthetician, but she's also a cosmetologist to begin with, and then she is also electrology professional makeup artist, laser hair practitioner, aromatherapy, lymphatic drainage therapy, reflexology, and vibrational sound therapy. And she been in this industry for years. Well, because today is just us, so she's been here for the past 45 years, even though she's very young. So Margie is yours. You can take over. Can we
Hi,
hear you?
everybody.
Oh,
Can you see me?
yes, I think they
Yes.
can.
I can't see the chat, so feel free to chat if you guys need to ask a question or anyway, thank you for the introduction, Phyllis. Thank you for having me today. This is very exciting. I'm going to present to you today my favorite treatment, which is called Revive. And this treatment is an oxygen treatment. It's considered a CO2 treatment, which I will explain exactly what that treatment does. It not only provides natural oxygen to the skin, but it also provides vitamin C. So it's brightening and it's also nourishing for the skin as well. And we're going to do the presentation first. I already have the model that's her face is washed. So we don't have to waste a lot of time watching the cleansing part and all that. We have 60 plus products. We're going to go into the introduction of the products and the PowerPoint after I do the treatment, because with this treatment, you do have to have at least 15 minutes for the mask at the end to sit on the skin. That's the minimum time. I've left it as long as 30 minutes because since I can do reflexology, sometimes I offer that with my treatments. But 15 minutes is like the minimum. So I'm going to go through the process. I'm going to show you all the parts. We'll open up the box so you can see the treatment, how it's created. What I'm excited about this product, and I've been working with Phyllis for a long time, over 20 years, and I'm very excited to present to you this treatment because it's one of my favorite. Why? Because it's an oxygen treatment that actually doesn't need or require a machine, which costs anywhere from $2,500 to $5,000 if you've been looking out in the shows for an oxygen machine. And I've worked with several oxygen machines before in the past. So as now that I am a solopreneur, I didn't want to invest in that machine. So Phyllis worked hard with her husband and they created this product and this treatment plan. And one of the things that I also like about this treatment is that it does not utilize hydrogen peroxide. There are some treatments out there that say they create oxygen on the face and they use hydrogen peroxide. That's not really good to use on the skin. It does destroy the cells on the cellular level. So our products does not have the hydrogen peroxide. So that's a plus. So this treatment comes with 4 treatments. I believe the price is $80. I'm not quite sure on that. I have to check if there was a price increase. Yes. Okay. The instructions are in there. And I'm going to go over the instructions with you one by one. And this is how it comes. I'm going to make sure it doesn't fall out. So you get 4 serums, 4 masks, 4 gels, 4 mask powders. And I'm going to go over each one in particular. Can you guys see that?
Yes.
Okay. So that's how the treatment comes. And the very first thing I do when I decide that I'm going to do this treatment, either I have already consulted with the client and I had to sell them on the treatment. Sometimes I incorporate a facial with it, and sometimes I do the facial the week before, and then they come in and have the oxygen treatment the week after. There's other things that you can combine with it. I sometimes will combine deep cleansing if you have an acne. It's excellent for acne because it kills the bacteria on the skin. It's excellent for anyone who's going to an event, has lightening for pigmentation, for just brightening, to give the skin a nice healthy glow. And of course, right before a party. So it's a treatment that can be utilized in a lot of different ways, and you can promote it. Once you know the treatment, you can promote it in so many different ways. You can promote it by itself as an oxygen and vitamin C treatment, or you can promote it after, when you have a client that that's been coming to you for a long time, and they trust you, and you can incorporate your facial with it and do this at the end. Of course, it's going to take a 2-hour treatment, because usually you want to do this treatment in about an hour, maybe a little bit less than an hour. But if you incorporate a facial, you want to include that hour. So that's a 2-hour treatment. I also have done a light exfoliation before this treatment, depending on how oily their skin is, or with our resurfacing pads, which I'll talk about later. And I've also incorporated a little dermaplaning for those of you that can do dermaplaning. Sometimes I have clients that want that. And so they'll have the dermaplaning first, and then, you know, I'll soften their skin up, and then we'll do the treatment. So the very first thing that I like to do, it's really important that I'm going to go over the 3 things that you pull out. So you're going to pull out the serum, the very first thing. And this is the mask activating serum. This has some fermented extracts in there. And this serum must go into either a cup of hot water for the first 10 minutes, or you can put it in your hot cabbie. Now I have an extra one in my hot cabbie that's been waiting, so it'll be warm as I use it. Then the next thing you want to pull out is your, I'm going to put my glasses on so I can see what I'm doing. After 40, you need it. Anyway, so this is the infusion gel, and this is what's going to go on the skin first. Now her skin's been nice and clean, so the first thing we're going to do is put this on. I'm going to bring it up a little closer so you can see the gel.
I think it's okay.
Infusion gel. Then we also have a mask, Magic C complex powder, which is our vitamin C. And I'll do that second. And
it's
then
it's a powder, yes.
It's a powder, yes. Vitamin C infusion. And then this is the cotton that we're going to actually infuse the solution with. So I'm going to show you how each step is, and it's very, very simple. But before I get started with that, the first thing I like to do once the skin is nice and clean is I like to take our lip lubricating plump, our lip plumper. And the nice thing about this is it's not just a lip plumper, it actually moisturizes the lips. It has some peptides in it, and it also has a nice taste to it. It's not real minty, it's not real irritating. I think it has more of a citrus flavor to it. And I use a little Q-tip and I put it onto the lips before I get started.
So Margie, there's a question asked, why we want to warm up the serums.
Oh, well, in experimenting in the beginning, we just found that the vitamin C powder diminishes much better, and it doesn't have like a grainy feel when you go to put the cloth mask. So I found after trials of experimenting with it that when I warmed up the serum, it actually created the crystals of the vitamin powder to break down a lot faster. And then when I put my mask into the solution, it was a lot smoother and it didn't have that grainy feeling. So that's why I like to leave it in there for 10 minutes. And that's something that we discovered afterwards, because, you know, when you create a product, sometimes you make things along the way, you discover there's easier ways to apply things on. So after times of using it, different times of using it, I just experimented until I seen that's what works.
Yes.
So that's basically what it is.
It dissolves the vitamin C, not only vitamin C, it's actually vitamin C with the grape seed. The reason we put the grape seed in, it is 20 times potent than vitamin C concerning the antioxidant issues. So we want feed the nourishment, the antioxidant to the skin. So vitamin C with grape seed. So we need the serums a little bit warmer to dissolve everything.
So the other thing is you want to have the right kind of tools to work with. So I have a nice little silicone bowl. I have a little glass bowl. Usually in the glass bowls where I put the gel, that I pour the gel in there, the infusion gel, and I have that ready. And then the second, the silicone bowl, I like to pour this solution, the
C powder,
the mask
first.
activator, and then I pull out the mask and pour the mask in there.
Right.
Let me just get my brushes, and I'm going to go get the hot, the warmed up serum. Hold on a second.
And I also prepare 2 brush. You know, the brush, when the brush touched the gel, when you first put it on the skin, I think you shouldn't use it. Anyway, each process using one
two
brush.
brushes. Yeah,
Yes.
I usually get 2 brushes, because one I use for the gel and the other one I use to mix the powder.
Mixing the powder.
Yes. So I don't want to mix the 2 before I put it on the client. So that's why I like having 2 brushes.
Yes.
If you don't have a hot cabbie, you can always use hot water, like from a teacup, from a tea pot, or and just stick it in a glass of hot water.
Mm-hmm.
So this has a little special cap on it. Once you put it in the heat, it's going to start popping up, and it pops up pretty well. If for some reason it gets stuck, you look where it says up, and that's the way that you pull it out. Before I put that, I'm going to pour my powder into my bowl. So I don't know if I could show you that, but that's
you can, Margie, you can actually put under the iPhone, before her face, or go up a little bit. Yes, like that.
So there's the powder in there. So I'll leave that aside. I'm going to, before I mix that though, I'm going to, let me just have to get a scissor to open up the gel. And I'm going to pour the gel into this glass jar. Now you get a nice generous amount of gel. You'll see that it's a lot more than you'll use, but sometimes I put it on the neck, and then at the very end, I flip over the mask, which I'll show you. And so that's the gel.
Up. Yeah.
Hopefully it won't drop it on her face. And then I'm going to, before I open the mask, so I will keep this aside.
I think you can dissolve the vitamin
C. Yes, I'm going to dissolve the mask the mask activator right now. And of course, I didn't get to
open it, right?
Yeah, got it. Sometimes it can be a little difficult. I have like an old tweezer that I use when I can't open it all the way. Because
Yeah,
I
you
have
can
very
either
short-
use, yeah, you can also use your scissors, you know, just pop it
No,
open.
I use my tweezer that it's an old tweezer because I don't want to cut myself. And I have very short nails. So when you have very short nails, it just doesn't allow you to grab things. So I poured the liquid in. And now I'm going to take my brush. And I'm going to mix it.
Can you put under the camera? Yeah. Up. Yeah.
Just mix it until it dissolves. And you'll be able to tell by the liquid that most of the vitamin C crystals have dissolved in there. Because if it was cold, you can test it. If it's cold and you go to put it in, for some reason, it leaves a little bit of a gritty feeling. I'm going to put my brush away because I'm not going to reuse that one. Let me just remove all my garbage here. And then the very last step is going to be to take the cloth mask, which has a little liner. So I remove the liner. And then I fold it back up. And I put it into the actual solution. Let's see.
Go up to her. Yeah.
Yeah. And I just saturate it as much as possible. And it will absorb all of the liquid, the solution. So before I put that on, I have to use the gel. So we're going to take the new brush and the gel. And we're going to start applying. And I always try to make sure I don't have the bowl in front of her face. I have it to the side so I don't pour it over her. I make sure that I get it under, and then you can get it close to under the eyes because the mask is probably going to fit under there. Sometimes I cover a little bit onto the brow because the mask will, depending on how big the face is.
Right. It won't hurt. This is like a buffer. The gel is really like a buffer. Don't let the vitamin C touch any raw skin. So you want to cover her with the gel well.
As much as possible. Yeah, the inner corners, under the eyebrow a little bit, and just a little under the eyes.
And also the top of the eyelid, you want to put a little bit. Just don't get into the eye.
Yeah, some people have a small face, so the mask will overlap on there. And of course, ask your client to keep her eyes closed the whole time.
And you can also put some protective gauze over the eyes.
And that's the other reason why I like to put the lip plumper, because it'll also, since it has a little bit of shea butter in there, it will help to hydrate the lips and prevent the vitamin C from entering onto the lips.
Can she remove the camera? What do you mean by remove the camera?
Can you see the application of the gel? Does everybody see that application?
I think there is one question here. Says, I cannot read it. More. Share screen, show chat preview. I mean, by coming to the computer, you know, we are kind of old, more mature, not really know what we're doing. Chat. Share
We're all
screen.
learning. It's a learning thing. We're
need
all
this.
learning
Okay, full
as we go
face
along.
is visible. We can see. All right.
Okay. Can you see how I applied it nice and generously? Let me get a little bit of eye. I'm going to put something on top of her eyes.
Okay. Yeah. And can you help us? You know, if there's any questions need answer, and
Well, let's do
type.
questions after I do the apply the mask. It's really important, this part, when we go to apply it.
Lita, can you see it? Can you see the whole face applying the mask? Because you say remove the camera, so I don't know what you mean.
I gotta cut that smaller. So I'm just going to cover her eyes a little bit, just so that. Now, one thing I want you to understand about this product, there's going to be a reaction. So this is the bicarbonate, sodium bicarbonate, which is the gel. And I just noticed there's a part here that I missed. And when I apply the mask that has the activating solution with the vitamin C, it's going to create a reaction. And that reaction is going to create a little bit of a stinging. So it's going to be a little peppery. So you tell your clients for the first 2 seconds, it's going to be very, it's going to burn
Tingling.
for 4 seconds. It's stimulating. And when it's stimulating, you might even hear some of the bubbling. And so I'm opening up the mask. And what I'm going to do is tap the skin. Once I got the mask on, I'm going to tap it so that I can just distract her from thinking about the stinging part.
You have to be do it as fast as you can when you put it on, and tapping and pulling. You can. Jolene, are you okay?
Sting. Going to sting for the first 2 seconds. So I'm going to tap it. I'm going to get it over her lip. Yeah. Does that feel better? Yeah, the tapping really helps distract them. And it's also stimulating. It's also relaxing when you tap the skin.
And Margie will explain why.
So if you notice, there's like a little bubbling going on. The bubbling is the oxygen that's being pushed into the skin.
No,
we'll go into the PowerPoint, we'll go into why that happens. Now that the skin has calmed down, does it feel better? Okay. There's several things you could do to make it fun and different that I've done with my clients. And you want to stretch out the mask as much as possible so it doesn't have any wrinkles, because it'll show up on her skin when you take it off. Her face is much smaller than the mask, so of course you're going to have some spaces in between. Now, you can do two things while you're waiting for the mask to stay on for 15 minutes. Can somebody time me there?
Okay.
And you can either use, we have a, I believe this is ivory. Is it ivory or is it a jade, white jade that we carry?
Yes, jade.
You can have, I like having two of them. Of course, I only have one right now, but you can roll the skin with the jade stone roller. And this feels good. I like having two so that I can do it at the same time. If your client, if you notice that they're feeling cold, because this will feel a little chilly or cold, I usually will wrap them a little bit so that they're not feeling too cold. And another thing that you can do as well, and this will help to give it a little compression. And the other option you have is you can use these, which are cooling globes. Everybody has cooling globes. You can, you know, apply it over, or you can wait till you're done and do a nice cooling globe at the very end before you put on. So it gives it
at
a
the
nice,
very end.
Yeah. Okay, so are there any questions that anybody has? This is a good time for us to go over questions while we're waiting for the mask to actually settle into her skin. This is a perfect time for Q&A, and then we'll go over the PowerPoint. Does anybody have questions, or they want to wait for the PowerPoint first?
I don't think we can hear them because
they can tune into the chat.
Okay, to the
chat box, yeah.
But at the same time, can we share the screen? Is Esther there? Share the screen with the yes. Okay.
So this is called Revive CO2 Mask. It's an oxygenation, renewal, and infusion of carboxyl, which is what?
Carboxy Bohr effect.
Bohr effect, yes. The Bohr effect is the name of the doctor that created it. Yeah. So this is our background. Conrex Pharmaceutical Corporation was founded in 1985 by Harvard and MIT educated scientist, Dr. Dean Shea, as drug delivery R&D innovative company. He discovered a way to deliver large density drugs into the body through the skin as an alternative to pills and injections. So we started out as a pharmaceutical company. The technology, which is called permeation enhancement technology, which is also in short term PET, was a medical breakthrough and received a patent in 1991 and the skin patent in 1998. Was granted FDA approval in pharmaceutical drug in 2002.
Do you want me to introduce something?
So the SESHA skin therapy started in 2000, and it is a science-based skincare line dedicated to slowing down the aging process of the skin by feeding and nourishing it. When I first discovered SESHA over 20 years ago, it was, to me, considered one of the top lines that carried a nutraceutical base to the product. So it took a lot of vitamins, and it took their technology with their patented, and it created that ability for the large molecules, which are all our antioxidants, our peptides, our collagen. All those ingredients cannot penetrate to the skin unless you have some type of delivery system. So we'll go into the delivery system on the way. The next one. So this talks about different ways that we get delivery into our skin of ingredients. We have either physical penetration, which, as you know, there's many aesthetic and medical fields through the electrical technology. You have high frequency, you have microcurrent, you have ultrasound, you have dermal rollers, you have radio frequency, you have iontophoresis. So you have a lot of technology out there that helps penetrate most products that are on the market that don't have a delivery system. The disadvantages of that is that it can be costly. Concerns regarding the uniformity of the current. So it depends on the actual practitioner that makes sure that she's using the right uniformity of the actual current of whatever technology she's using. The destruction of the skin that can happen if they're not using the right technology for the right skin type, and trained practitioners that are needed to do those treatments. Chemical penetration is an enhancement system. There are 3 types of chemical systems. You have liposomal delivery, you have nanotechnology, and you have PET, permeation enhancement technology. And for home care, chemical delivery systems are more desirable. Liposome technology, well, we're going to go into the next one, I think. So we have, these are all the different skin types, skin layers that we have. And just imagine the top part of the skin is your stratum corneum. And there's many layers in between there. And if you see, there's like this little section where it's gray, and it's then there's a green section. You have your epidermal, lucidium, granulosum, spinosum, and the basal layer. And then you have the dermal, which is the very bottom of the epidermis, deeper than the dermis. I mean, deeper than the epidermis. And that's where your hair follicle is, your nerve fibers, your blood, your lymph vessels, your collagen, your elastin. That's where all the nourishment happens. And as you can see at the bottom, the different textures and shapes that the actual cells. And as they come to the surface, if you notice, they are round in the middle and full. Then they start to kind of flatten out. And every 30 days, our skin cells will shed off. By the time it gets to the top of the surface, which is the epidermis, where is that black line, you see the cells are a lot more compressed. They're a lot flatter. So they're really not absorbing any more nutrient when you put it on the surface, unless you have products that are going to go deeper into the skin cells to grab what it needs as far as nutrients, vitamins, elastin, collagen, and all of that. So the 3 routes of penetration to the skin barrier is transcellular, which is into and through the stratum corneum cells. So it goes straight through. 2, you have intracellular, which is around in between the overlapping stratum corneum cells. And then you have the I can't say that one, epidagial route through other pathways in the skin. That one is really through the hair follicles and the sebaceous glands and the sweat glands. So our delivery system really is a permeation enhancement technology. It's patented and FDA approved in pharmaceuticals. It's biodegradable polymeric matrices that deliver cosmetic molecules through the SC for deeper penetration.
Stratum corneum.
Stratum corneum. Targets specific treatment areas, improving results. And then it works well with the large molecules, the weight of peptides, amino acids, lipids, vitamins, hormones, and other ingredients. Every one of those wonderful ingredients that you see in most products are all large molecules. They can't penetrate unless they have some kind of technology, either through chemical or either through physical. So this is how our PET works. It increases the solubility of the active ingredient. It increases the permeability of the skin, and it facilitates the transport of actives through stratum corneum's lipid channels. And if you see on the left, you have active ingredients without a delivery technology, and you can see the ingredients are just sitting on the surface, just within that stratum corneum. Now, with our PET technology, it goes in between it permeates in between the cellular structure of the skin, and it brings it down to the level where the skin cells are going to be able to grab it at the bottom of the epidermis. So it's almost at the top, just before the dermis. You can't say that it delivers into the dermis because that would be prescription, but this gets very close enough for the cells to recognize, oh, I might need some vitamin C. Oh, I might need some peptides. I might need some collagen. So that's what that does. This is some of the clinical studies that we did. If you look at day 1 and then day 80, you can see that there was kind of like a space in between the top part of that cellular structure. And then after 180 days, you can see that it filled in. So the collagen did definitely grow more, for sure, the elasticity, and the cells actually enlarged. On the middle section, I believe that is pigmentation. It shows
Right.
us, yeah, pigmentation from the dermal layer. If you notice, the top picture has quite a few spots and the pigmentation. And then if you see the second picture, it has a much more clearer surface.
Mm-hmm.
So some of the pigmentation has definitely diminished. Then you have the last one. I can't see what it says on there. This
It's
one's
really-
for fine lines. So that
it's
one's for fine
really,
lines and
yeah.
wrinkles. Yeah.
It's
So
really
you-
show bigger area of your skin. This is using different kind of stain. So this is a
Okay.
bigger area. You see the smoothness of the top layer of the skin. So that means before all this is kind of like a wrinkle, and then now it's more smooth. The reason is because they are more filled. I mean, your epidermal layers is actually thicker than before because the turnover rate is going faster and they remain, so the skin grows thicker. And
So
then,
now the top picture will show that line, meaning that's a deeper line. And as you can see, the second picture, the line is not as deep.
right, it's more smooth.
So it's smoother.
Mhm.
So
This
it's
is
absorbed.
actually skin. So many people showing nowadays before and after just the picture, but we actually do the what do you call the puncture from the skin itself.
The clinical results.
Okay.
So there you can see the difference of the skin. And this is using our clinical line, which is really designed for our mature skin or anyone with dry skin. Here's some more pictures. The top one is a woman who had pigmentation, and you can see that the left picture shows the pigmentation, and then you can see that it's certainly brightened up the skin a lot. And that's using, can you go back to that picture again? Yeah. So then you have another lady underneath, a little more mature. And she also has the pigmentation around the cheek area. And you can see it looks so much brighter. And see the difference from August to December. So it's a few months. And her skin just looks definitely a little bit more brighter and a little more firmer too as well.
Right.
Okay. Next picture. So this is the breakdown of the actual treatment I just did. So you have all of the ingredients and all of the things that you need to do for treatments. So each treatment, you're going to use these 4 items, and you have 3 other treatments left. So carboxy therapy means carbon dioxide therapy, which was initially developed to minimize the skin irregularity because of residual fat deposits after liposuction. It's really big in Europe. CO2 gas injected into the residual fat deposits may reduce or eliminate post-liposuction residual fat deposits and improve skin regularity. And at one point, it was very popular. It still is popular in certain parts of Europe, where they inject the legs and the buttocks and the hips for the cellulite. Currently, carboxy therapy is a procedure that uses carbon dioxide and claims to get rid of stretch marks, cellulite, and scars, as well as plumping the skin. Micro injections of carbon dioxide are injected just beneath the surface of the skin.
That's the meso. That's what people say, mesotherapy.
Mesotherapy, yes. So the Bohr effect is a physiological phenomenon that was first described in 1904 by a Danish physiologist, Christian Bohr. Hemoglobin's oxygen bind affinity is inversely related both to the acidity and to the concentration of carbon dioxide, CO2. An increased blood of CO2 concentration leads to a decrease in the blood pH, which results in hemoglobin proteins releasing their load of oxygen. Now, a good way to explain that is that when the plasma, which this is how he discovered it, when the plasma's pH was too acidic, it brought in the CO2 to minimize the acidity and create oxygen to balance out the pH.
For example, when you do exercise, I mean, you're panting because you need more oxygen. Oh, 15 minutes come up.
That's okay.
So
we're gonna leave it on a few minutes.
Yeah, actually, the longer is okay.
What
Yeah,
I'm
15
gonna
to
do
30
is
minutes.
I'm going to now take it off the face and put it onto the neck while I finish this up so that you can see that. If you want to switch over 1 minute and then we'll go back to the PowerPoint.
Okay. Oh, where is the other camera? We don't see it. Margie, we don't see your camera from your phone.
Can you look at John?
The iPhone. Oh, here, coming up.
Okay, can you see now?
Yes.
Okay, so what I'm doing is the leftover gel, because there's still quite a bit in there, I'm going to use it on the neck. And I'm going to take the mask and going to just remove it. And I'm just going to lay it on top of the neck.
Yeah, her skin is not red at all.
Yeah, no, it's not, because we left it on for a good 15 minutes. So that's the minimum time. Sometimes I leave it on for 30 minutes, but the minimum time, and you can see her skin looks really nice.
Very good.
And then at the end, once I take this off, when we finish the PowerPoint, I'm going to wipe her down with a nice lukewarm cloth. And that's just going to remove the residue on the skin. You don't want to leave this residue because she'll have flaking the rest of the day. Okay, can we go back to the PowerPoint? We'll leave that on for 10 minutes. Okay, so let's see, go back to the Bohr. Yes, so we talked about that. So yeah, exercise is a good way to know that your body produces oxygen when it's moving.
Yeah, so you are breathing faster. That means your body is filled with the used waste. That's CO2. Then your body need more oxygen, so that's why you're breathing will heavily faster. That's what he discovered. Oh, that's the whole reason your body distribute more blood to all your circulations, and then that bring more oxygen. So that's what we created is CO2 concentrated on your skin. And then when the blood rush to your face, that's the tingling coming out. But once you are tapping it and it calm down, and then the blood with oxygen will saturate the whole area and then try to bring the CO2 away by feeding more oxygen. So this is actually an oxygen mask. It created oxygen to your face.
Okay, the next one. So this new innovative infusion mask is based on the carboxyl and the Bohr effect theory. We utilize pure vitamin C with grapeseed extract, which is 20 times stronger than antioxidant C by itself. Vitamin C, which produces the acidity when the mask makes contact with the infusion gel, and that gel is the bicarbonate. A chemical reaction produces an excess of CO2, and that's what the bubbling, you will hear the bubbling, you will see a little bit of the bubbling penetrate through the top layer of the skin. Carbon dioxide releases the oxygen molecules through the capillary walls, and it dilates and facilitates the blood flow. The oxygen expels the CO2, which is the waste matter. It promotes circulation, it stimulates cell regeneration. It's antibacterial, so it's perfect for anyone who has acne or breakouts, or, you know, just to keep the skin clean. And it tightens the pores. It improves the pigmentation. So anyone that has pigmentation issues definitely restores a natural and healthy glow. So it's actually excellent for all skin types. I've used it on every skin type. So I can say that this treatment is a nice staple treatment.
Right.
So this talks about the ingredients now. So in the Magic C powder, we have the L-ascorbic acid, vitamin C, and the grape seed extract. The L-ascorbic acid is essential for collagen reproduction and transcriptional regulation of collagen synthesis. It may inhibit elastin biosynthesis that could be useful for reducing the increased elastin accumulation that occurs in photo-age skin. L-ascorbic acid reduces pigment synthesis by inhibiting tyronase, and L-ascorbic acid produces epidural barrier function, apparently by stimulating the sphingolipid production. Grapeseed extract that was produced from fresh seeds, reliable, a domestic supply that we actually get it from. Water-only extraction with spray dry into a crystal form. And the water soluble is 20 times stronger in an antioxidant property than vitamin C. So that is why we added the grapeseed extract, to give you that bonus of more antioxidants, more nutrition for the skin to absorb. The activator, which is the serum that we talked about, the little jar that you have to put into the hot cabbie or to warm up in the beginning, which is our solution. This has the water and seawater. It has cinnamon, cassia bark extract, which is from cinnamon, Poterium official root extract. It also has Zingiber official root extract, Camellia sinensis, which is a green tea, hibiscus, Saccharomyces, and it has some fermented ingredients in there, especially the radish root ferment filtrate. So that's what we mix into the powder to create that liquid, to mix with the powder. The infusion gel has the sodium hyaluronate, sodium bicarbonate,
That's seaweed. That's
seaweed extract,
Mm-hmm.
Chondrus crispus extracts, hydrolyzed chondrus crispus. So it's all seaweed, really, that's in there.
Mm-hmm. Right.
And the radish root ferment filtrate.
That's a natural form of preservative.
Right, exactly.
Mm-hmm.
Okay, the next one, that's just telling us how to use it, to unfold it, which I already went over, all the steps. So this is the benefits that you're going to get from the Revive CO2 mask. It restores and detoxifies the skin health. It maintains the oil and moisture balance. It improves and evens the skin color, reinforces skin tone and strength. It minimizes wrinkles and fine lines. It helps to clear acne and post-acne marks. It tightens and refines pores. And so it provides a smooth, youthful facial contours. I think that is it. Does anybody have any questions? Please put your questions through the chart. This is a good time to do that. I'm about to take the mask off, and we're going to use just a cloth to remove the residue, and we're going to apply a moisturizer and then a sunscreen.
Or I don't know, Esther, can they talk? Can we unmute them and then they can ask some questions? It's easier for them to talk.
I believe they are able to unmute themselves.
Okay, if you want, if you have, okay, Tia?
Hi, Sasha, or hi, Phyllis. It's Teresa from Bear Med Spa.
Yes, hi.
Hi. How often can this mask be used?
You can do this treatment once a week if you wanted to. If you have a client that wants to come in once a week, it's awesome.
Okay.
But
Great.
it does, you know, for special events. I mean, for some people there, I have clients that come every 2 weeks, so they'll want to do it. But yes, once a week is fine, or once a month, whatever your clients are willing to do.
Look at her neck.
Okay.
Look at her neck.
I have
It's brighter than the rest of her body.
Did you say that it could be applied to other, like the décolleté?
Yeah.
You can, but the mask isn't really designed for that unless you, there's not enough solution to do the décolleté. I mean, you can, instead of doing the neck, you can do the chest if you want. You can take whatever mask you have left over and just put it right over.
I
Okay.
don't think we have the dry cloths, you know, if
No,
I can get one.
But you can get the benefits still by applying the gel in that area right before you take off the face mask. If you have another 10 minutes, what you can do is put the gel there, then take the mask off and then flatten it as much as you can and fill in the holes with the holes, you know, by overlapping it, and then just use that for now until we create something else.
I know it
All
now.
Hi.
We'll look into it. Thank you.
Hello. Hello. Hi,
Yes.
Phyllis.
Hi.
This is
Yes.
Ying.
Who
I
is
have
this?
questions. So, Ying,
Ying. Hi, Ying. I don't even see your name. Yes, go ahead.
I know. Sorry, I had iPhone, I guess, right?
I see.
Showing.
Okay, maybe. Yeah, okay, that's you. Okay, go ahead.
Yeah. I have a question that mask activator, it directly goes to the warm the
Cabby.
cabinet.
Yes.
The
You wish
direct
the bottle. Yeah, you can put the whole bottle in the hot cabby.
it won't explode, right?
No.
Nope, I've left
Okay,
it in
okay.
there. Believe it or not, I've left it in there as long as a half hour almost, which you don't need to do. You need to at
Right.
least leave it in there 10 minutes. But
Right.
you will notice that the top part, I don't know if you can see my screen. The top part of the actual bottle will start to pop up a little bit.
Okay.
When you take it out of the hot cabby after 10 minutes or 15 minutes, you'll see that it sort of pops up a little bit. So it makes it a little bit easier because it's starting to move. It's fermented in there, so it's starting to move. So it'll be easier actually to pop off the top because it has a plastic and then it has the metal piece to protect it. And so there is a little on the actual, I don't know if you could see it, it says up right here. So that's
Arrow,
where you would lift up and then take it out.
Or you can
Okay.
remove the
And
part. You can remove the top because they also have a plastic cap.
Yeah, but I find that I
Sometimes we
just
lose.
leave it. So it
Okay.
doesn't leak.
Okay.
I don't want it to leak. So I just leave it all on there. And then when I take it out of the hot cabby, it's already popping. So it makes it
Yes.
easier to take it out.
Okay.
so that kit can use for 4 face, right? 4 times.
No.
The kit has enough for 4 treatments.
Yes.
Yeah, 4 treatments. That's what I mean.
Yes.
Yeah,
Yes.
for 4
yes.
treatments. Okay, I have a question. How did you charge for treatment?
So you could charge anywhere from 75 to 150, depending on your area, depending on how you promote it.
Okay.
I usually charge 150 if I'm going to, promote it as a vitamin C and oxygen treatment. If you're going to include a facial, you can do 200. But if you're just going to do the treatment by itself, it could be anywhere from 75 to 100 or 125. You really have to kind of see what's your average facial treatment, and how much
Okay.
is your client going to be willing to pay. So sometimes I include it into my facial at the end, when they have the time, and I let them know it's an extra 75 or it's an extra 100, depending on
Okay.
how much detail I've done, because sometimes I have to do extractions. So if I do extractions,
Yes.
she's gonna feel it stinging more, so she needs to trust you. But I have done it after acne treatment and it works really well. I mean, the skin just heals so much nicer the rest of the week, and it just looks beautiful.
So that means after extraction, that's more sensitive. The skin's more sensitive, right?
The skin will be a little sensitive. So what I do is after extractions, I'll put a little bit of hyaluronic acid, a little HA, and that'll just hydrate the skin. And it won't be like, and they will feel a little stinging, but it's only for 2 seconds. It really is only 2 seconds, and you tap the skin right away. So this way they can get distracted and they relax.
Okay. Okay. And
And
also
if you feel uncomfortable with doing it on the day you've done extractions, what I recommend is have the client come, have the extraction facial first, a week or a few days before, and then have her come back for the oxygen treatment by itself.
Yeah, okay. Good idea. And also I want to PowerPoint. Can you reverse to the page which is how to step up to do the treatment? Can you show me
Okay.
that piece?
Okay, that's yes, you unfold the mask. But see, now here, is that the first one? Is there another one before this? No, okay, so that's the first one. Yeah, so it's just telling you unfold the mask, you put that on your table, you just take out the plastic, but I fold it back up. You have your 2 bowls. One bowl is for your solution. The other bowl is going to be for the gel.
Okay, I just want to copy this screenshot. Good.
Well, you're going to get that in the box. It'll have
I didn't.
yeah,
I
and if
Okay.
you, I would suggest everybody, if you're gonna, when you buy this treatment, give yourself a treatment so you know what to expect, you know what to feel, and you're gonna see the benefits of it. So save one set for you.
And also, nano. Are you guys have a nano treatment?
Yes, yes.
Nano.
The
Are you
pen,
going to have a nano
the Miso Botanica,
Zoom meeting?
is that the needle Miso Botanica pens treatment
Yeah.
demonstration? Yes, we will schedule that one.
Yes, we will do that another treatment. You can do that. We'll do
Phyllis,
that.
can you send me the information, the date or whatever?
Okay, I will. Time's up. Yeah, Margie, time's up.
Oh, okay. So the next thing I'm gonna do is I know her skin, she has normal to slightly oily, and sometimes she gets a little oily because she's under a lot of stress sometimes. So I'm gonna use the Plus Emulsion, which is designed for normal
Plus
to
emotion.
oily.
Yes.
And then the very last thing I'm going to apply, first I'll apply the eye infusion gel. This is an excellent eye cream, which is a little creamy, but it's smooth, and it's great for young skin or even mature skin as well. And then we have the Prevent and Protect sunscreen with SPF 30. Those are the 2 things I'm gonna leave her with.
Okay.
And that completes our session. If you have any questions, feel free to reach out. I've been working with this company for so long. I know the products went back in my hand, but I can answer any questions. You just text me, and I will be able to text you back with any questions.
Yes. Very good. Thank you so much, Margie. And how about Jolene? How do you feel? I know it's
Yeah, I feel
go
good.
ahead.
My skin feels very firm.
And you can see that,
It
turn your
looks
face a
lighter.
little bit. Yeah.
Yeah, her neck is really
Like
light.
you could see the difference. Yeah.
Yeah, yeah, very good.
Definitely
brighter.
improved.
Yeah.
Yeah, wonderful. So anybody have more questions? You can unmute yourself and talk to us. So if it's not, we will let you know our next class, maybe after July, maybe in August, we will hold because everybody's busy during the summer for vacations, and we have another 2-3 shows coming up. So after that one, we will come back for more class. But in the meantime, for the the Mesopotamical pen, we do have a video open box. That means step by step. If you have not received that one, please contact me. Contact order at SESHA, then we will send it to you. So anything else, contact us at order at SESHA. Everyone, order at SESHA Skin, yes. On SESHA Skin Therapy to everyone. So no more questions, then we will close right here. Thank you for everybody participate.
Thank
Thank
you
you.
for coming.
Thank you, Margie,
Okay,
and thank you,
Phyllis.
Jolene. And thank
Okay.
you, everybody.
Welcome.
If you need to talk to me, you can call me my office 610-355-2454. Again, 610-355-2454. Thank you, everyone. Have the good rest of the day. Take care. Bye-bye.
Bye-bye.